Welcome to the Columbia University Lyme Disease Association Annual National Conference on Lyme and Other Tick-Borne Diseases. It is my pleasure to welcome you and to tell you just a little bit about what you might hear and learn if you attend our conference on October 2nd. It's a virtual conference, so it's easy for you to attend, and I hope you will. Dr. John Aucott is director of the Lyme Disease Research Center at Johns Hopkins University School of Medicine, and his talk is entitled Long Haulers, Lessons from Lyme Disease, ME/CFS, and COVID-19. And as you can imagine, there's a lot of overlaps between those syndromes, and he's going to talk about those overlaps and potentially how knowing about one of these long hauler syndromes might help the others, et cetera, and they might mutually help each other and so that we can help our patients better. Dr. Monica Embers will talk about combined antimicrobial therapy for the eradication of Borrelia burgdorferi. So she'll be talking about new treatment approaches. She's an associate professor in immunology and director of vector-borne disease research at the Tulane National Primate Research Center in Louisiana. So her work focuses on animal models and has direct clinical potential significance for humans. Dr. Kenneth Ligner is an internist with specialty training in pathology and critical care medicine. His talk is entitled Disulfiram in the Treatment of Lyme Disease, Promise and Perils. In this talk, he will summarize his 4 years of experience with disulfiram in the treatment of Lyme disease. Dr. Kim Lewis is professor of biology at Northeastern University and also director of their Antimicrobial Discovery Center. Will talk about promising new therapies for Lyme disease and the impact upon the gut microbiome as well. So using sequencing data from a stool of cohort of PTLDS patients, they identified a gut microbiome signature. And they've also identified an agent that doesn't alter the gut microbiome but does kill Borrelia. So he'll be talking about these novel and important new findings. When we get to the more clinical approach talks, you'll hear from Dr. Adrian Baranchuk, who is a professor of medicine at Queen's University in Ontario, Canada, and editor-in-chief of the Journal of Electrocardiology. He's a terrific speaker. Everybody learns a lot when they listen to his lectures, and he'll be talking about Lyme carditis, the most common clinical presentation being high-degree AV block, and he'll review his findings on the successful treatment of AV blocks in Lyme carditis with antibiotic treatment without putting in a permanent pacemaker, and he will report for the first time long-term follow-up results on these patients. Then we move from carditis to the brain, so we'll be talking about psychiatric disorders associated with infection. The first talk will not be about Lyme disease, it'll be about Bartonella and Bartonella bacteremia and neuropsychiatric illnesses. And this is given by Dr. Edward Breitsworth, professor of medicine and infectious diseases in North Carolina at North Carolina State University College of Veterinary Medicine. As you know, he's one of the world experts on Bartonella. And he did a study recently that was published that looked at the presence of Bartonella by PCR among patients with psychosis, schizoaffective disorder, or schizophrenia, compared to non-psychiatrically ill controls. So this is a fascinating study that has potential importance in neuropsychiatric disorders, not just in psychotic disorders, but other work that he's done also suggests it may be important for pediatric acute onset neuropsychiatric disorders, otherwise known as PANDAS. I'll be talking about another interesting study, which was a study of 7 million people, all the people in Denmark over a 22-year period. They were followed up to see what happened among those who developed Lyme disease and were diagnosed in the hospital setting compared to those who never had a Lyme disease diagnosis in the hospital setting. What happened in terms of the rate and the frequency of mental disorders, suicidal behaviors, and suicide after the hospital-based diagnosis of Lyme disease. This was done in collaboration with some of the best psychiatric epidemiologists in the world, led by Dr. Michael Benrose and his colleagues Trine Madison and Annette Erlangson. And then there'll be a fascinating talk by Dr. Marina Erickson, who's an adjunct faculty at Hormel Institute at the University of Minnesota, and she specializes in advanced microscopy imaging techniques. And her title is Bartonella henselae detected in malignant melanoma, a preliminary study. This is a preliminary study of 8 patients with malignant melanoma to see what they could find in terms of Bartonella. And really, what is the pathobiome of melanoma? So this is really at the frontier of understanding of the role of microbiome in cancer, specifically melanoma, but cancer in general as well. And then there'll be an interesting talk by Dr. Ricardo Maggi, who's a research professor at the College of Veterinary Medicine at North Carolina State University. His talk is entitled Simultaneous Detection and Absolute Quantification of Babesia, Bartonella, and Borrelia by Droplet Digital PCR. This is a much more sensitive way of doing PCR in detecting organisms. And they were able to create this new assay for the simultaneous detection of those 3 organisms. Dr. Catherine Brissette will move into the realm of pathophysiology now, and her talk is entitled Borrelia colonization of the dura mater, which induces inflammation in the central nervous system. She's an associate professor at the University of North Dakota School of Medicine and Health Sciences. Her work is very important. It's in the mouse model, but it does demonstrate, and she'll be presenting her exploration of inflammation in the central nervous system, which obviously has implications for why people might have persistent CNS syndromes, if what we learn from the mouse model has anything to do with what might be going on in humans. And finally, a really fascinating, totally somewhat mind-blowing talk by Dr. Brandon Jensen, who's in the Department of Biochemistry at Virginia Tech. His talk is entitled Not Just Another Brick in the Wall, The Unusual Peptidoglycan of Borrelia burgdorferi. So when I heard his talk, I didn't know if I was going to be interested in his talk, but I have to say this is probably the most interesting and fascinating talk that I've heard in years, because it has profound implications for our understanding of the pathogenesis of Lyme disease, as well as potential for the development of new diagnostics. So I don't want to steal his thunder by telling you about his talk, except to say you need to come to listen to it. Thank you.